Hello, my name is London Ollis, and this is my Etiology project for Bio 275. I have chosen to do my project on HIV/AIDS. I picked HIV/AIDS because it has always had this type of voodoo surrounding it. It causes panic in people, myself included, due to working in healthcare. I am a fan of the band Queen. Freddie Mercury, the lead singer, is probably the most famous person to be diagnosed with HIV/AIDS. He unfortunately passed away in 1991 from pneumonia, a direct result of AIDS. His risky lifestyle made him a target of contracting HIV. The origin of HIV has always been interesting to me. HIV/AIDS is zoonotic, meaning a spread from animals to humans. HIV is genetically related to the simian immunodeficiency virus, or SIV, which is carried by monkeys, mangabes, and chimpanzees in Central Africa. The best-known theory of how HIV came to be in humans is that the population in the Democratic Republic of the Congo hunted, killed, and ate the SIV-infected primates, which allowed the virus to cross over into humans. Although there were isolated cases earlier in history, it was not recognized as a clinical diagnosis until the 1980s. HIV was initially associated with homosexual men due to early cases being identified in that community. However, anyone, no matter their age, sex, race, or sexual orientation, can contract HIV if they are exposed to it. There are more at-risk populations, such as populations with decreased access to health care, education, drug use, and risky lifestyles. HIV is short for human immunodeficiency virus. HIV essentially attacks the body's CD4 cells, or helper T cells, weakening the immune system. AIDS is short for acquired immunodeficiency syndrome. This can occur 8 to 10 years after contracting HIV and is known as the end stage of HIV. At this point, the helper T cells will be severely decreased and the immune system will also be severely damaged. The traits of HIV is essentially its ability to weaken the immune system by attacking the CD4 T cells. This, in return, makes the body vulnerable to opportunistic infections due to the inability of the immune system to fight off such infections. Before the spread of HIV/AIDS, it was considered an endemic. Since its spread, it was deemed a pandemic by the World Health Organization in 1981. HIV/AIDS is known as a retrovirus. A retrovirus is a virus that works backwards from the way human cells do. Human cells have DNA that sends a message to RNA to make building blocks for your body. Retroviruses have their instructions written on RNA. When the virus invades your cells, it changes its RNA to look like your cell's DNA. It essentially cuts the cell's DNA and inserts its instructions into them. The cell then acts as if the virus's instructions are its own. This then allows it to replicate itself and kill the T cell through apoptosis and pyroptosis. This is a picture of the structure of HIV. Each part has a specific role to play in the HIV life cycle, which we will discuss next. The HIV life cycle has 7 stages. Stage 1 is binding, where HIV binds to receptors. Stage 2 is fusion. The HIV envelope fuses with the CD4 cell membrane, allowing HIV to enter. Stage 3 is reverse transcription. HIV releases and uses reverse transcriptase to convert genetic material. This is why it is a retrovirus. The conversion of RNA to DNA allows HIV to enter the CD4 cell's nucleus. Stage 4 is integration. HIV integrase helps HIV integrate its viral DNA into the DNA of the CD4 cell. Stage 5 is replication. Once integrated into the CD4's DNA, it uses parts of the CD4 cell to create long chains of HIV proteins, allowing HIV proteins to build. Stage 6 is assembly. New HIV proteins and RNA moves to the surface of the cell to assemble into non-infectious HIV. The final stage is budding. The non-infectious HIV pushes itself out of the host. New HIV then releases protease to break apart protein chains in the non-infectious virus, hence creating a mature infectious virus. The various components of this each play an important role in the HIV life cycle. The mode of transmission of HIV includes bodily fluids like blood, semen, and breast milk. These are transmitted person to person through sexual intercourse, sharing needles, mother to fetus, in the healthcare setting by accidental puncture wounds, blood transfusions, and even organ transplants. HIV primarily affects the immune system, but can also affect the skin, lymphoid tissues, kidneys, brain, liver, lungs, and GI tract depending on severity and status of HIV in the infected person. There are 3 stages of HIV to help set us up to discuss symptoms. Stage 1 is known as acute, in which people may experience flu-like symptoms. Stage 2 is the chronic stage, but some people may be asymptomatic. And stage 3 is the end stage, known as AIDS. The early signs of HIV include flu-like symptoms. If treated, though, some people may not have symptoms for years. Some people infected may also experience skin rash, night sweats, muscle aches, fever, fatigue, and swollen lymph nodes. Left untreated, HIV can turn into AIDS and open the door for opportunistic infections like pneumonia, TB, and fungal infections. To discuss complications, again, if left untreated, the end result of HIV is AIDS, which leads to opportunistic infections, various forms of cancer, as well as cardiovascular, neurological, liver, and renal issues. The prognosis of HIV/AIDS has improved significantly with advances in medicines. Treatment includes antiretroviral therapy, which is a combination of medications that are used to suppress the virus and prevent it from replicating. This, in return, can allow the immune system to recover. Currently, and unfortunately, there are no immunizations to prevent HIV/AIDS. Prevention is key, and being well informed and educated on how to prevent contracting this virus is essential. There are 3 types of diagnostic tests to diagnose HIV. This includes an antibody test, an antigen antibody test, and nucleic acid test, also known as NATS. Combination antigen antibody tests are far more accurate than traditional antibody tests, particularly in the acute stage of infection. This concludes my etiology presentation on HIV/AIDS. Thank you.